and thank you everyone for the opportunity to share and present on Bristol Myers Squibb Study Connect platform. As an engagement strategy lead with global development operations, I focus on bringing the voice of the patients and caregivers into the clinical trial design and implementation. So let me share my presentation. There we go. So at BMS, we strive to bring meaningful change and improve the patient experience and generate greater diversity in clinical trials. So through global expansion and innovative approaches, BMS has created an industry-leading patient engagement forum. Although Study Connect is not new, we have added several digital capabilities to support patients and caregivers before, during, and after their trial. Now, what is Study Connect? It is a leading patient engagement website for patients, caregivers, and health professionals. The comprehensive platform helps patients to learn about clinical trial research and find clinical trials in their community. I will share how Study Connect is dedicated to increasing clinical trial awareness, participation, and patient engagement. On the side, you will see this is the home page for the US site for Study Connect. Very inclusive, very engaging, easy to read. And again, this is because we receive feedback from patients like you. We have three core areas that we focus on for the Study Connect experience. First, educating you about clinical trials and the conditions that we research. We have a call center that actually answers questions that are frequently asked by patients, caregivers, and loved ones. We have a glossary of terms and a list of support organizations on the site. Additionally, we have dedicated web pages for patients, for parents, and healthcare professionals. Second, we're connecting patients directly to sites through the patient referral process, which I'll discuss a little bit later, and providing sites with potential patients through our screening questions. So that means we link you directly to the sites so that we have the follow through to ensure that you have support along the way. Again, before, during, and after your clinical trial experience. And lastly, we're engaging patients and caregivers through videos, stories, and again, as I referenced before, the call center. Now, this is an example of a study protocol page. Once you search for a trial and select a trial, this page will open up for you. And on this page, you can see you have the trial description, the recruiting status, the treatment options, eligibility criteria, and a map of trial site locations. You're also able to share this information with your family and loved ones, but then most importantly, you can share it with your HCP and have that as a talking point when you go in to speak with them about clinical trial options. Now, here's the screening process I was speaking about or referenced earlier. We offer the opportunity to match you with clinical trial sites. And by completing the patient pre-screener, they will ask you questions related to your condition. After you complete the questionnaire, Study Connect matches you to potentially appropriate trials. And here's an example of a trial being listed here. And we would follow through with you and making sure that you have information that you need. But then also, one of the great things about this tool is that it does not only match you to BMS trials, it also matches you to non-BMS trials. That is an industry standard that we have set, and we're proud to continue to set it. Now, also we have the patient referral process, where that when you complete the patient screener, your information is shared with the site so they can follow up with you. You receive an email confirmation, the BMS staff receives an email confirmation, and then they will follow up with you to ensure that to follow up with you to see if you have any questions about your participation or going to the site so that we have that follow through for you. Again, we are here to accompany the patient through the process. And finally, our call center. Our call center is supported by a vendor called Pharma Centra. They support calls from the US and Canada in English, Spanish, and French. Additionally, they support emails globally and the same 3 languages. We are happy to have this call center because we want patients to have a resource to go and ask the questions that they may have that might be on their mind. Now we talk about our commitment to diversity. BMS remains committed to diversity and inclusion. And these are the ways that we have done it within BMS Study Connect. First, we have patient-centered language that puts the patient first. Second, we have an internal diversity in clinical trials advisory committee. This committee is comprised of diverse BMS colleagues that provide feedback and insights on what we're doing within BMS Study Connect. Part of that included ensuring that we had diverse imagery and content on our website, ensuring that our patient-facing recruitment materials were inclusive of those of the communities we're trying to recruit. Additionally, for BMS Study Connect, we have dedicated country sites translated in the native languages for those countries. We also feature stories on diversity in clinical trials and resources from patient advocacy groups such as yours. And coming soon, I'm so excited to announce, we're actually going to have a banner on each webpage highlighting our commitment to diversity so that when patients come to the site, they now know that we are truly committed and we're going to follow through in everything that we do and our commitment to the patient. And then finally, having dedicated diversity page with online resources for patients to know that they have resources in their community to support them through the clinical trial process. And as we saw in the survey earlier, is making sure that patients know that there's the availability of resources, and this is a place that you can come to and find out about those resources. Again, walking with the patient as they go through the journey. And as I've mentioned previously, we have the global sites. And so I wanted to show off a little bit about our global sites. We have 17 countries and 13 different languages. And France is coming soon, so we're excited to have them be part of our footprint. But this says that for patients that are located outside the US, there are resources. There is a Study Connect that again can match them with clinical trials, BMS funded and also non-BMS funded. And this is just a summary of all the features I highlighted. I wanted to make sure that I highlight the key points. But first, you learn about the clinical trials that we have ongoing. You can search for clinical trials using keywords, study numbers, and locations that are close to you. You can answer the pre-screener questions to find the best match trial for you. Additionally, you can view and print those clinical trial details so that you can share with your loved ones and more importantly with the HCP to initiate that discussion around clinical trial engagement. You can follow conditions, trials, and clinical trial sites and receive email notifications. You can register at participating clinical trial sites to be contacted directly from the site location. You can find frequently asked questions, support organizations, and a glossary of scientific terminology that you may not be familiar with. And finally, we have a dedicated call center to help you along this process that we're committed to be with the patient. I thank you so much for this opportunity to share this presentation.